Hi everyone, this is Dr. Alina Haider from India. She is a uh, she's MD in gynecology and obstetrics, and she has agreed to give us a short interview on our project, AI related imaging on breast cancer detection. So welcome, Dr. Alina Haider.
Thank you.
Could you kindly tell us what are the problems that you face in breast cancer detection or cancer detection in general in medicine field, specifically breast cancer detection,
Thank you,
diagnosis,
Miss.
basically diagnosis.
Okay, I'm getting. Thank you, Mr. Syed Aqib Haider. As you know, breast cancer is the second most common cancer that we find globally, and it is fourth most common cause of death, cancer-related deaths all over the world. There are certain gaps that we have in diagnosis of breast cancer, and that those gaps are at different levels. For example, they could be due to socioeconomic status of the patient, their inability to reach the healthcare facility at the correct time, then health awareness, lack of health awareness, then inadequate access, delayed diagnosis. There could be limitations in current screening methods as well, the technology, inadequate use of technology. Then there could be at three different levels. It could be patient related, or gaps at provider level, or at the level of technology. Uh, so, what else would
So,
you like to?
so my project is of course related to technology, basically AI based, how artificial intelligence can enhance diagnosis of breast cancer. But before going to that, I would like to know some what are the challenges patients typically face during diagnosis, and doctors, how do they, what are the challenges that they face, and how do they go about it?
Patient-related gaps, usually patients face difficulty in recognizing their symptoms. Sometimes the breast cancer may not always present with common typical symptom of lump. It may have unusual symptoms which the patient may not be able to recognize. Then a patient may not take her symptoms seriously. They could be perceived less severity. Then poor health awareness is very common, especially in the countries
Low
with
income countries, yes,
low income
yes, that's
countries.
one.
Then there could be patients may have fear or stigma related to the diagnosis. So that is at the level of the patients. Then,
Avoidance,
yeah, they do not accept that this could be the
yes,
symptoms could lead to
acceptance,
that severe
yes,
kind of diagnosis.
carcinoma,
Right, right,
yes,
right.
yes, yeah, sure. And what was I about to ask? Something occurred
Uh,
to me, but anyways, what do? Yes, I was about to ask. Could it be asymptomatic also? Breast cancers. Could it be asymptomatic?
Yes, sometimes it could be asymptomatic because the detection of the symptoms may not be clear clinically, because when we start diagnosing, there is no clear-cut screening protocol that could identify the individuals who are at high risk, and it could we do not have those tools which are so widespread. It can be used for screening purpose. They are comfortable for the patient. They are at low cost, so patients may not come up with the may not be able to understand their clinical symptoms so at such an early stage. So you can call them, sometimes it is asymptomatic also. They may not notice their symptoms actually.
So, how do the doctors deal with breast cancer if they feel that the patient might have breast cancer? How do they diagnosis? What is the first and second line of diagnosis and treatment?
There are usually for diagnosis of cancer, especially the breast cancers, we have three levels of diagnosis. The first level comes through the clinical diagnosis, which is based upon the signs and symptoms which the patient may present with. Then the second level is that of imaging. Because imaging is non-invasive, we may subject the patient to such tests which help us in screening those patients which we suspect, as doctors, we suspect that this patient might be having cancers. So then the third level is that of pathological diagnosis. So this is tri-modal, uh, basically system of diagnosis. In pathological or the final level, we try to extract some cells from the lesion and we subject them to microscopic examination where it is proven that this
Biopsy,
person, yeah, yeah,
typically biopsy.
FNAC, it could be cytology, it could be biopsy. Right, but that is
Okay,
basically
okay,
pathological level. So these are the three levels. Number one is clinical, second is imaging, and the third is pathological, histopath.
okay, okay, sure. So, the so imaging is the second line of diagnosis when you feel the patient comes up with some symptoms.
Yes.
So we know that the various methods in imaging are mammography, and advanced one is MRI, I guess. So could you
Mhm.
please elaborate upon imaging diagnosis?
See, imaging is a very significant tool as far as diagnosis of different types of cancers and uh, especially breast cancers is concerned, because the biggest advantage of imaging is that it is non-invasive. So, subjecting a patient to a non-invasive test is far
Non-invasive, painless
comfortable and
procedures.
acceptable, right? So, the best way to diagnose the imaging that we use is ultrasonography at the first level, then we go to the mammography, and then the third is we may use contrast enhanced ultrasonography, and sometimes advanced technologies like photoacoustic imaging and all. And the best thing is to combine them and individualize the test depending upon the patients and how much we are suspecting, their sensitivity, specificity, and all that it counts.
Okay, so is it possible that these tests do they require specialized equipments, or is it possible that a simple camera image of the breast can help in detection, which the patient can, for which it if that is possible, it could be simply be the case that the patient can without even the referral of any doctor or advice of a physician, she can simply upload the pics. She could take it from her phone, upload it to a particular server or cloud, and then it could give a certain, not in, if not exact, then a certain percentage of risk that can happen. Could that be a possibility, or is it already a possibility?
Uh, as of now, I don't think this is very common, especially in country like India, because sometimes benign lesions may mimic cancer. So examination by a trained individual, by a healthcare professional is definitely important. But yes, if we are able to educate our patients and they are able to recognize their symptoms and if they can do this at home and send images which could help us screen them out, that would be really helpful, especially because in country like ours where people are not very open, and it may be because of the social stigma and because of the taboo that the patients may not come up very easily to the, they may not go to the clinic. So such a modality would definitely help us in reducing those missed out cases, right?
So, okay, so can doctors or gynecologists simply imagine you only have images of the patient's breast and you do not have patient physically present to you, just by a doctor's trained naked eye looking
Yeah,
at the images, can you assess the risk factor of breast cancer or
that would
possibility?
be very yeah,
Because if you can do that,
it
then
is a,
AI can replicate that. That is
see,
the
this is
reason from my side.
this is easy, but yeah, if this happens, this can be done. I'm not saying it will, but there are certain obstacles to this thing, especially because there are certain types of cancers which are not very easily detectable even on imaging. For example, non-calcified lesions, mammography will be missing such lesions. And I think if a doctor sitting at one's clinic and not examining the patient and listening to the history as a whole without analyzing the risk factors, may not be able to exactly get to the diagnosis, and there are chances of missing it out. For example, a woman at maybe 55 to 56 years of age group, having a family history of breast cancer in her first or second degree relatives, with all those history of high risk, and coming to doctor's clinic with a lesion and giving history, she may have more chances of having a malignant lesion rather than a younger woman with no such lesions, with no such history. So
Yes.
if that factor is, somehow we are able to overcome those factors, then yes, definitely this will help.
Hmm. Okay, so what while you were telling this, I was imagining a digital system without involving the services of a medical provider, where we can have
Mhm,
such history, we can take such history as well as the
mhm,
images for diagnosis,
mhm,
and
mhm,
it could at an beginning level of diagnosis, um,
mhm,
supplement the or ease the workload of medical service providers, be them medical technicians or doctors or
mhm.
you know uh, the people of the diagnostic industry. So could
Yeah,
that be a possibility?
yeah, I think it is a possibility, and it's a good possibility, because if AI is able to do
And
that.
it will be affordable as well, because it will not involve the services of doctors for such initial stages of diagnosis.
See, if this is a possibility, it is an advantage. It will put I think, all the doctors at an advantageous position, especially because there could be human errors in interpreting the imaging, with the naked eye, and AI at least will be able to, I think, standardize those images and those signs which we note on the images directly, right? So if that is standardized, so there are lesser chances of human error, lesser chances of missing out lesions,
Okay, so by human
especially if it
error,
is if it is affordable. Yeah.
by human errors, do you mean that there could be signs on the image which the doctor might miss?
Yes, yes, definitely.
Okay.
In one patient, the interpretation could be different, and in another patient with the same signs, the interpretation could be different. That is human. It could be there.
Okay,
If
so
we are able to use
okay,
AI, maybe that difference is overcome.
okay. So with that, I would thank you very much, Dr. Alina. I would close. I would like to close this interview with the last question. What is the current state of breast cancer management? How many patients, once diagnosed, um, make it through, get treated
Mm,
for good, and how many are unable to get treated and eventually, oh, is it? I guess it is mortal. I mean fatal. But
mm,
and in case the situation is whatever the situation is, good, bad, ugly,
mhm.
uh, what is the how much blame can you put on poor diagnosis for breast cancer detection?
See, I think you are asking about the prognostic factors, the prognosis of the
Yes,
disease.
prognostic, yes.
Right. So, the prognosis, actually, breast cancer is one of those cancers which can be treated. It has got moderate kind of prognosis. It is, if detected, the most important prognostic factor is the time of detection. It should be early detection and adequate treatment. For early
Which is the
detection,
case
we
for
need to have,
most cancers, I guess.
yeah,
The issue is
yeah.
the delayed
No,
detection.
certain, there are certain cancers which have got poor prognosis, so they may not give enough time to have a screening. There should be some period that gives you a window of screening. Breast cancer is one of those malignancies which have that advantage, that it gives you some time for screening. If you amongst high risk patients, if you detect them early, for that we need effective screening tools. Right. And if we are able to detect them at the correct time, at the right time, early diagnosis, that is the best, way to manage them. The load of the disease is much less, and the effect of maybe surgery. These are the basic, techniques or modalities of treatment, which include surgery, radiotherapy, chemotherapy, right? So that is effective only if the load of the disease is manageable and it is not detected at a very late stage. And that will be possible only if we have effective screening tools. And for screening, the tool should be acceptable, it should be affordable, it should be non-invasive, comfortable for the patient, right? And also the cost, yes, so that you can apply those screening tools over large number of population. Only then it will be a screening tool. So if having an effective screening method or technology is, I think, the crux of early detection and adequate management at the right time.
Okay. Okay. Thank you so much, Dr. Alina, for your time. And
You're welcome.
okay, thank you so much.
Thank you, thank you, thank you, Mr. Akil.